Welcome to the Pharmacy Frontiers podcast, the podcast dedicated to the profession of pharmacy. Today, we're excited to come to you with our Missouri Pharmacy Association President-elect, Dr. Roxane Took. And it will be a great conversation for us to talk through what her experiences are within the organization, plus a little bit about what her journey is as a professional pharmacist and how she balances that with the day-to-day life. Let me remind everyone that the Pharmacy Frontiers podcast is available on your favorite podcasting app, whether it be Apple or Spotify or YouTube or even Podbean. And that the comments and suggestions made today on the podcast are those of our hosts and of our guests. And so it's not a representation of the Missouri Pharmacy Association, SSM, nor Mercy. So now with that, let me introduce Dr. Roxane Took. Roxane, welcome to the show.
Thanks for having me on the show today.
This is fantastic. We've been looking forward to having you on the show for several months now, knowing that you're going to come in as our new MPA president-elect. And so there's a lot of things we want to talk to and learn from you about that. But before we get there, give us a little bit of a background of your journey within pharmacy so that we can get a good idea of what your career looks like and where you're coming from.
Yeah, so I first was introduced to pharmacy in high school. I think my mom was trying to help me figure out what I wanted to do for a career, for a living, and she had mentioned pharmacy as an option. I shadowed a pharmacist. I can't even remember where she worked, but she did some compounding, and I thought, oh, that is so cool. I definitely want to be a pharmacist and provide counseling and mix up some medications. That's definitely what I want to do. And so I applied for pharmacy school, and I actually worked through my all through pharmacy school at Walgreens, at a chain pharmacy, and I really, really enjoyed my time. I thought this is definitely what I want to do. I enjoyed, interacting with patients and getting to know them. And then it wasn't until my last year of pharmacy school that I kind of was like, well, what is this residency thing? I knew that I was interested in doing a residency, but at the time when I was in pharmacy school, there was kind of like a big push for more of the hospital-based residency programs. And there wasn't very much information that I knew about community-based residency programs. So I actually had to do some research and digging to learn about those residency programs. And so I am a huge advocate, I will say, for if anybody is interested in a community-based residency program, you should go and do a residency program there, and then feel free to reach out to me after the podcast if you ever have any questions about it. But so I did a residency with UMKC in Kansas City and Price Chopper Pharmacy, a grocery store chain. That was back in 2014. And I really enjoyed my experience there. It was such an advanced community experience. We had vaccine clinics that we were in charge of. We saw patients one-on-one for chronic disease state management, like with hypertension, dyslipidemia, diabetes. And then I also had some staffing component too. So it was really a broad experience that I had. And I enjoyed it so much that I didn't just stay in Kansas City for 1 year. I actually stayed for an additional 3 years. And I think what most people don't realize is the whole time my husband was still in St. Louis. Yeah. So for 4 years.
You stayed at Chopper then for 3 years, or for 2 years after the residency.
For 3 years after the residency.
For 3 years after the residency, you stayed with my Chopper while your husband was still, oh my gosh.
Yeah.
That is
yeah. So he at the time was working at his dad's donut shop. And so he would work Monday through Thursday, and Thursday, as soon as he got off work, would rush to Kansas City to come see me. So I really enjoyed my time there. But then it got to a point where we said, okay, one of us has got to move to one of the cities. So we applied to jobs in Kansas City and St. Louis and kind of prayed about it. And, the decision was made for us to move back home to St. Louis. And so that's when I started my career with St. Louis College of Pharmacy, and I taught there.
It was a great career. You had very great feedback from students as to loving you as an instructor, I believe.
I guess Megan must have spoke very highly of me at the time. So I was at St. Louis College of Pharmacy, I think I was trying to do the math. I think it was like 4 or 5 years total. I was actually getting ready for promotion at the time, and during one of the Missouri Pharmacy Association meetings, a colleague of mine from pharmacy school had said, "Hey, Roxane, we have a position opening at SLU Hospital. It's a transitions of care. We're opening a brand new transitions of care clinic, and we need a strong pharmacist to help build this program and identify what it is that a pharmacist should do as part of this team." And what I kind of flew by and didn't mention is during my residency program, that's when I first became interested in transitions of care. And I did some research on transitions of care in the community setting with our employees and dependents at Ball's Food Store. And then throughout the years, while I was in academia, I was involved with the APHA Transitions of Care Special Interest Group. And I was like coordinator-elect, chair, and had a lot of leadership roles with transitions of care, and then helped provide several presentations and publications regarding transitions of care. So it was really a difficult decision for me to leave the college because, I had such great experiences with the students and faculty there. But I decided to come here at SLU. I think that was in 2022. So I've been here for a while now.
In transition to care, that is one of the future pillars of hospital and health system practice, isn't it? That really is a growing field and something that a lot of the students are interested in being a part of.
Yeah, it is really, there's a great need for a lot of people to be involved in transitions of care. It's not like a quick fix. I think what I see is I feel like a lot of times people think that a lot of the efforts need to go upon discharge, and they do. You do need to provide a lot of education at discharge and make sure everything's smooth there. But you also need to think about when the patient's admitted, getting the correct medication list there, and making sure the medications are indicated. Then, providing education throughout the hospitalization. So that way there's not just like a dumping of information when the patient discharges. Because if you've ever been in the hospital, it's overwhelming. Your last day, you're like, get me out of here now. And you're not really soaking in that information.
No, I think you're absolutely right. I think that's one area where all of us that are hospital based need to do a better job of that, right? I think we're going to have a steady career in critical care, internal medicine, all the rest of the transplant kind of things that require acute care stay, but so much more of that care now is going to hospital at home or going to ambulatory care setting. So that role of that transition of care is so important that we maintain that continuity of care and get our patients healthier quicker and at a less cost, right?
Mm-hmm. Yeah, I agree.
Yeah, I think it's definitely an area of great growth and a great opportunity for someone like you that has that good teaching background to take students. I'm assuming that you probably are a very popular rotation site for students to come to do the transition of care rotations with you.
Well, now you're putting me on the spot, Daniel. So I take students for shadowing experience. Anytime that there's a student at a SLU, the SLU inpatient pharmacists are like, "Can my student come and shadow you for the day?" I'm like, "Yeah, of course." But we just last year started being involved with the PGY1, the inpatient PGY1 residency program. And so now we take those residents on a rotation through our bridge clinic. We also, this upcoming academic year, will take PGY2 residents as well. So I think we're slowly building more and more, and we're also slowly increasing the amount. Well, actually, we've rapidly increased the amount of patients that we're seeing here in the bridge clinic too. So we haven't gotten to a good steady state where we're in a consistent rhythm yet.
And take advantage of that layered learning, right? When you have PGY2s, PGY1s, you have undergrads, that is a fantastic way to do it. And folks like you that are so good at mentoring those students to make that happen. I know that you're a role model, not only in your practice, but a role model in how you do that teaching process.
Yeah, thanks. Yeah, it's a fun environment here at the Bridge Clinic. We have medical students, medical residents, attendings, nurse practitioners, physicians assistants, nurses. So it's a big team that's here, and it's not really a big clinic. We only have 5 rooms and a pretty small space. So just having the space for everybody can be a little bit of a challenge.
It forces that teamwork, doesn't it?
Yes, it does. It does.
Well, let's move on to the role in the MPA, because I know you've been a board member for the past 4 years. Is that right now? Is this your 5th year on the board?
I think I joined back when I was at the college, so that would have been like 2017.
Like, so you're right. So this is, oh my gosh, we're in our 7th year. So in this September, you're going to be installed as the president of the Missouri Pharmacy Association at the annual meeting at Margaritaville.
Yeah. It's kind of crazy. I can't believe it.
So we put the plug in there for all of our listeners, right? To go out to the Missouri Pharmacy Association website and get registered to attend the annual conference. So tell us about your journey through MPA and what you're looking to accomplish as a presidential officer.
Yeah. So I think I was part of MPA as a resident. I actually went to school at SIUE in Illinois, so I wasn't part of MPA as a student. It was more of afterwards in my residency program that I became involved with MPA. And I remember going to legislative day and kind of learning how to speak to a legislator and all of that. I have also served in the membership committee in that role, just to kind of try to increase our membership and increase involvement with our pharmacist. And then kind of served through all the different roles in the board of directors positions as well. It is kind of weird to go back and reflect, because I'm like, it feels like it was a blink of an eye going through all these couple of years. Like, I don't know where the time has gone. But a lot of our efforts with Missouri Pharmacy Association have been, or a lot of my efforts have been in regards to advocacy. And especially the time that I was at the college, it was, providing education to our students so they felt comfortable advocating for our profession, because they are our future, right? So.
Well, you're gonna take over the realm from Roxane, from Roxane. Sorry, from the current presidential officer, Kendall, and so continue a lot of the initiatives that MPA is working on now, including some of the PBM reform and some of the other practice initiatives. Are there any new initiatives that you're going to bring forward that our membership should be aware of?
I think it was last year we surveyed our members and we said, what is it that we should be focusing on? And they said, with a resounding PBMs. So that is my main focus. In this next year, I would really like to try to unify our pharmacists in Missouri. I know that a lot of people might think that Missouri Pharmacy Association is just for community pharmacists, but that's not true. We're for all pharmacists and all pharmacies. So I want to unify our voices, so that way we can try to get this PBM legislation passed once and for all. We've been working at this for quite a while now. I can't even remember how many years. But this is like a bigger issue than community pharmacy. It is a big issue for community pharmacy because a lot of our independent pharmacies are closing or suffering because of low reimbursement rates. But I mean, even for me here in the hospital setting at SLUC and at the Bridge Clinic, I'm seeing a lot of patients unable to go to their local pharmacy. And so they have to, maybe their insurance is restricting which pharmacies they can go to. They're not able to afford their medications. There's issues like prior authorizations. Maybe the doctors don't know how to do a prior authorization or aren't getting the notifications. So this is really like a bigger issue of the patients aren't getting the medications they need. And so it's increasing our rehospitalization rates here at SLU, and it's impacting so many other other patients too in other ways.
Glad to hear you say it that way, because I think you're absolutely right. I think a lot of our pharmacists, a lot of our pharmacy students think, well, this isn't my problem. PBMs, I'm just a worker bee. I let my manager take care of that. Or I work in a hospital and we don't have to worry about that kind of thing. But you're absolutely right. All of the hospitals in the state of Missouri, the majority of all the hospitals, have some sort of a retail component to it, some kind of a take-home prescription component, and they're affected by those reimbursement rates. And so you're absolutely right. We need to have a unified voice and a unified vision when we're advocating for these kinds of reforms and these kinds of changes in order to make the best for the patient. It's more than just raw money, right? Oftentimes we're criticized by the state legislatures that we're just trying to get a money grab. But the reality is it's not about the money. It's about the ability to take care of our patients in the right way and being able to give the patient access and choice of access so they can go to the pharmacy of their choice to get the kind of care that they need. And that sometimes is difficult, especially in a rural state like Missouri.
Yeah. Yeah. And then just making it a fair playing field for all pharmacies, I think the reimbursement should be the same regardless of which pharmacy a patient decides to go to. It's not fair to, provide reimbursement of 5 cents when, that's not going to keep your lights on or pay for the pill bottle that the medication's in. So providing fair reimbursement as well.
Yes, indeed. And MPA had success last year advocating for one of the bills that affected the 340B program to ensure consistent reimbursement, whether or not it's a 340B eligible hospital or not. And so same thing going forward with the pharmacy benefit manager reforms to make sure that those pharmacies that have access to the patients also have access to the same kind of reimbursement. And then that brings about good patient care and good patient outcomes, which is what we're all striving to take care of.
Yeah, I agree.
I know from your experience, and very similar to my experience within the MPA journey, it does take up a fair amount of time to be on the calls, to travel to Jefferson City, to be a part of legislative day, to be a part of the recruiting effort, and even making the presentations at the meetings and whatnot. Tell us a little about how you balance that with your life, and give us a little bit of update on your new baby. We want to hear how things are going at home.
Yeah. Well, as Daniel's alluding to, I have a 15-month-old son named August. We call him Gus. He was named after my husband's grandpa and my grandpa as well, with a middle name. So I'm sure there are many members that are also mothers or fathers, or just have busy lifestyles. So I'm not any exception to the rule of that pharmacists just live busy lives. It's hard to sometimes figure out how you're going to balance all of your time, especially like right now having a little one. You all of a sudden realize you don't have as much time to yourself as you once did. But I think for me, some of the things that were important is making sure that I communicate to my leadership here at work. A lot of our meetings occur during the day. And so I reached out to my boss as soon as I got hired on, saying, Missouri Pharmacy Association and advocacy is very important to me. I'm serving in the board of directors, and I would like to continue the service. Setting expectations of, these are the time obligations that you can expect. This is the travel that I might be doing. And so letting her know about all those things ahead of time. And then I kind of asked for permission, but kind of was like, this is a deal breaker. Like I need to do this. And luckily my boss was very supportive of our advocacy efforts, my advocacy efforts. And then she's actually asked me to give some presentations to our Missouri ambulatory care pharmacists to fill them in on what's going on. So I know I gave a really good presentation, I think, right when I came back from maternity leave about PBMs and all of that. And so I'm lucky to have good leadership here at my work. The other thing that's been really helpful is that I have a wonderful support system. My mom watches my son Monday through Friday, and then picks up any shifts if she needs to, if there's meetings that I need to go to or anything like that. And then of course my husband. So my husband has been like my biggest cheerleader throughout like my whole life, my whole adult life. I've been with him for a really long time. And so he's been really good at cheering me on and like, you can do this. I will do whatever I need to do. I will watch Gus however many days I need to. Don't worry about it. Don't look back. You just need to keep doing what you're doing. So I think for me, the biggest things has been my support system and communicating, what my needs were in order to get this stuff done. And somehow, if there's a will, there's a way. So that's kind of how I fit things into my schedule. It just kind of happens.
Takes a village, doesn't it, to raise a family? It takes a village to run a professional association as well. It takes many volunteers to bring it together, and you're definitely one of those leaders that helps bring it together, and you role model those behaviors of being available, but also being able to balance your family life as well.
Yeah.
I remember a number of years ago, you brought to one of the board meetings some of the donuts from the family donut shop. Is that something that your family's still engaged with?
Yeah, so my father-in-law owns Old Town Donuts in Florissant and in Cottleville. The Florissant location's open 24 hours a day, 7 days a week. The only day they're closed is Christmas Day. And I think it's because Jeff and his family refuse to work on Christmas Day. But if Keith could find some people to work, then I bet you they'd be open. Whereas the Cottleville location's open like 5 a.m. to like 9 p.m. They make donuts 3 times a day, so they're always fresh. Always have a fresh donut. They are my favorite donuts, and it's not just because of family ties, but unfortunately, the locations probably are like 30 minutes away from where I live, and not really in. I don't head over to Florissant too much, or if I do, it's to see my family, so I don't get donuts as often as I would like. But just thought I'd put in that plug.
I think that's a good plug, and maybe we need to talk about making that donut shop the official donut of the Pharmacy Frontiers podcast.
Yeah, I think so. I think so.
You were mentioning working with your boss about having time available to be a part of MPA and whatnot. And I hear that story again and again from a lot of our society leaders, that it really is a matter of making sure that your employer is engaged, and that then trickles down, right? If the boss is engaged and supportive, then the coworkers within that pharmacy are more likely to be engaged as well. And I think that's a great take-home lesson for a lot of our pharmacy leaders, is if they role model those behaviors, and others will be engaged, and then we have a much bigger tribe to affect the kind of changes we want to make effective.
Yeah, no, I agree completely. I feel like just having the opportunity to go to the meetings and speak to my colleagues in ambulatory care, kind of, I hope, like set a fire inside where they're like, yeah, why aren't we advocating for these things? Why aren't people going to Jeff City? Like, shouldn't we all just go to Jeff City and talk to our legislators? It's like, surprise, we do. It's Missouri Legislative Day. You all should be there. So.
Well, tell us, you have experiences with working with lots of students during your faculty days. Mm-hmm. What is your advice now that you have separated just a little bit from day-to-day faculty work with the college? What's your advice to that next generation of pharmacists coming out of school right now? What kind of advice do you want to give them?
I think my advice would be to ask questions. Don't be afraid to say yes. Don't be afraid to be involved. I feel like throughout my pharmacy career, I had some opportunities come up that maybe made me a little uncomfortable. Like whenever I was teaching, somebody had said, hey, would you like to give a presentation in Beijing, China? And I said, oh, I've never been to Beijing. Okay, yeah, that sounds good. What would you like me to speak about? And if I wouldn't have had that experience, I wouldn't have gotten to learn about pharmacy in different countries. I wouldn't have built relationships with other pharmacists around the world, with the International Pharmaceutical Federation, to learn that, a lot of us are dealing with the same issues of trying to practice at the top of our license. We know so much in pharmacy school, and we're not being utilized to our full potential. So I think that there's so many great experiences out there, and you really open the doors to those experiences when you say yes, and when you ask questions, when you lean in versus being like, no, I don't think so. That doesn't sound like me. I don't really know anybody over there. Like, what's the travel time? So that would be my biggest advice to students.
Very good. Thank you for sharing that. And as we come to the end of our time here on this podcast, I got to tell you, Roxane, you're a great guest. I look forward to having you on again, perhaps partway through your presidential year, and we can have Tim join us and hear a little bit more about your adventures and your successes as we work through the MPA presidential year. But as we wrap this up, let me give you the final word to put in a plug for MPA, or whatever it is that you'd like to say about the upcoming annual meeting.
Yeah, we're going to have the MPA annual conference that's coming up. So make sure that you go to the Missouri Pharmacy Association website to register for that. This year it's in September. I have to look up the exact dates. I believe it's around that September 11th weekend. We usually kick it off with like a golf scramble. So for those of you that are golfers, make sure that you sign up for that. And then we have a lot of continuing education throughout the couple days and weekend. And then the whole thing kind of ends on Saturday night with this gala. And so if you've never been to the gala, it's a really fun event. Lots of music and dancing. And so I really encourage you all to sign up for Missouri Pharmacy Association's annual meeting. I promise you'll meet a lot of people and learn a lot and have a great time.
Friendly, so bring your kids, bring your family, bring your coworkers. It'll be wonderful.
Yeah. I know my husband and Gus will definitely be there, definitely on that night of the gala.
Good, very good. Well, thank you, President-elect Roxane Took, for being with us today in the Pharmacy Frontiers podcast. And I'll remind all of our guests on the podcast that these podcasts are available on your favorite streaming app. And go out and subscribe to the Pharmacy Frontiers podcast so you can get updated when the latest podcast drops, so you can hear from other MPA members and other leaders similar to what Roxane has done for us today. Thank you for being with us, and we look forward to hearing you on the next Pharmacy Frontiers podcast.